Helping Seniors Television, all about improving quality of life for seniors. If you're a senior, know a senior, or plan to be a senior, then this show is for you. It's all about helping you develop your own aging plan so you can age actively and with dignity. Helping Seniors Television from the Helping Seniors Network of information, education, and resources.
Understanding the best Medicare plans can often be time-consuming and even confusing. Learn how to make the best pick as Keith Giles of Verus Health Partners shares some tips and things to consider with Helping Seniors TV host Joe Steckler.
Welcome to this edition of Helping Seniors. Personally, I am excited to do this show because what we're going to do through Keith Giles, I got that wrong. It's Keith
Giles, yes, sir.
There's a lot of people use Giles like there's a Giles Malone here down in Florida Tech, and that's why I got to thinking about that. But
I know that guy.
Your expertise, Keith, in Medicare,
yes, sir,
is something that more people need to understand. But we're going to get into that. We have 8 questions, 8 areas we want to talk about, folks, and we are going to cover each one of those because it's extremely important. But I have to first say that Keith served 23 years in the Air Force, which is, nothing compared to my 38 years in the Navy.
I always get bashed by the Navy guy, so that's true. That's right. I can't compare that. So you got me.
Keith, regardless, my wife's family is mostly from the Air Force. Well, all Air Force, really.
Hurrah.
Except our son. He had the good sense to go in the Navy. Her brothers were in the Air Force. Our daughter's husband is in the Air Force. He's getting ready to retire as a 3-star general. But, your military experience, just like my military experience, brought you to a community, and you started a completely different field from what you did in your service, the same as I did in most respects. But I think our military training made us recognize that there are needs in a community that people are afraid to tackle, or once they get involved in something, they're afraid to say more about it, because so many people are afraid of offending somebody. And I think, we both have our military retirements. We both have our military access to medicine and everything. So I think people like you and me can safely say something to a viewing audience that maybe somebody else might be afraid to say. Do you agree or not?
I agree. I totally agree with that.
Yeah.
I think it's embedded in us as veterans through leadership that we are always asked to do the right thing. And that's how we just, I could tell you a story. A senior officer once told me, he says, Keith, you're going to be up in the service industry. And I was like, no, I'm not. I'm going to be a mechanic the rest of my life. And here I am in the service industry because of the leadership that I had in the military. And that's how I ended up in this business, I believe.
That's a good way to say it. I really think. But your company is called Verus Health Partners. And as I found out more about it, I recognize the need for you to explain to our viewing audience exactly what is Verus Health Partners and why. Well, I know you think it's important, but now I also think it's important. But explain to them just what you all do and what your company does.
Okay. Well, basically, we're a veteran-owned business, an independent health insurance agency that specializes in Medicare, group health insurance, and individual marketplace. So we're made up of, here's the unique thing about Verus Health Partners, is that we have brokers that are all independent. So that means they can shop around for you and get the right match for you as if you're a Medicare client. And Most of our Medicare brokers are from different areas in industry. Like we have, of course, we have some veterans, but we also have a police officer. We have a bunch of educators or teachers with us. We have some corporate people, and I come from an engineering background. We actually have an engineering background with us as well as Medicare agents. So when you talk to one of us, we're usually giving you probably more than what you need in information, but we want to make sure that you understand what's ahead for you in the Medicare market. For instance, my father was actually he's a veteran, Army veteran, and he was placed on a plan that didn't quite fit his needs, and he ended up paying unnecessary out-of-pocket cost. And that's actually how I got into the industry, because I needed to find out more about, what was the right match for my family, for my mom, my dad. And each one of us as brokers, we carry the same values of research. We research what's available for them. We educate our clients so that they can make a good decision, a good educated decision. And then the other part of our business is that we're advocates up in Tallahassee and DC. So we cover that in too, and we try to keep our clients up to date with those things that could be that's going to change year to year on the Medicare market. We have the good advantage of our TRICARE for Life, and
Now, TRICARE for Life is a military program.
that's right. And I've seen people try to move folks off of TRICARE for Life and Medicare, which is a big no-no. So if I could say that.
What do you mean? You said you saw people try to move people from TRICARE to some other program.
Right. So you'll have original Medicare. Once you get age 65 and you have TRICARE, you have the option to actually move from TRICARE for Life onto a Medicare Advantage plan.
But why would you want to do that?
You wouldn't.
Okay.
It's the industry's pushing us that way. So that's one of the things that when we sit down with somebody that's on TRICARE, getting ready for TRICARE, we tell them, don't touch it. Don't believe anything they say.
Well, wait a minute. But who would try to convince somebody was on TRICARE, or why would they do this? Try to convince them to go from TRICARE to some other plan. Would it be a Medicare managed or an HMO would try to do that?
It could be somebody of that thing. I think what happened with my father was he didn't tell them he had TRICARE. So it'd be easy for them to say, oh, well, you got Medicare, and he didn't tell them that he was on TRICARE for Life or he was a retiree, and they put him on there by mistake. I think that's what happened, but I'm not sure. And that could happen because sometimes.
No. This is important. Are you telling me that you have found instances where insurance agents would try to move people from TRICARE onto a program they sponsor?
It happened to my father. It happened to my father, and I've heard other people come to me in our office and at my booth at the flea market and ask me, hey, what should I do with TRICARE? I said, don't touch it. Okay, somebody told me I should move, and I said, well, did you tell them you're on TRICARE? And they said, no. So that's why I'm thinking they're not getting the whole story, especially when you call an 800 number and you're ready to go on the Medicare. If they're probably not going to ask the question if you have TRICARE for Life.
Boy.
So
I'm starting to understand what you're saying, what your company's doing. Let's say, I'm trying to figure out, people can't get onto the Medicare. If they take their Social Security at 62, they still have to wait till they're 65 to get to Medicare.
Correct. That's correct.
What would be, does Verus, do you sell insurance, or do you have agents in your network that sell insurance?
All our agents can sell insurance under 65 and over 65. So we're all licensed to sell health insurance.
But Keith Giles, do you sell insurance yourself?
Yes, sir.
But Verus, is that how you pronounce it, Verus?
Yeah, Verus.
Verus. But your company is more than that. You're sort of like Shine,
Yes, sir.
and Shine is serving the health insurance of Florida's elders, and health insurance needs of Florida's elders. Um, you work with Shine.
Yes, sir.
Why would it be? Why would I'm trying to get you to tell me why it's so important for people to know about what you do.
Okay. When you turn 65, what's happening is that you're getting inundated with a bunch of booklets, agents, phone calls, emails saying sign up for this plan, that plan. And it's actually overwhelming. We've had people that will come to us and said, I've been reading this book for like 3 days, and it's like, well, don't really need that one. You only need the one from Medicare that they give you, because everything's the same from one carrier to the other. So we should try to straighten those things out for them. Because what we don't want to see people do is end up in the wrong program for that year, and then find out their doctor's not in the network, or their prescription drugs not available to them.
But you're talking now about like Medicare managed programs, or
Uh,
you're talking about health maintenance operations.
Both,
Both?
because you're talking about HMOs, you're talking about PPOs. So you have to look at the whole picture for each
Right.
person.
I agree.
If they're travelers, you definitely try to keep them away from an HMO, uh, your health management
But
organization,
why?
because they're stuck in the network. If they go out, and they get in they have a catastrophic event somewhere else, and they're covered emergency services. But this has happened before with folks when they're covered emergency wise. Once they get out of the hospital, and if they have to go into rehab, it's out of their pocket, full out of their pocket. So we try to keep them from making those types of mistakes. Good example is our snowbirds, right? So we get them in plans that you can transfer their plan from Florida back to their home state up north. So
Okay.
without incurring any extra out of pocket expenses. So those are some of the things you got to look at. Is what's their lifestyle? Then we kind of tell them and give them the information they need to make an educated decision. Sometimes we'll guide them there, but it's ultimately up to them. And if we believe that if you give the folks the information they need, they can make an educated decision on their own.
Okay. You said three things were very important. And one of them is, I call it the book. That's the thing that's about a half inch thick.
Correct.
It comes out every
Every year.
December. And it's your Medicare for right now it's Medicare for 2018.
Right.
And there is so much information in that book.
Yep.
I wonder how many people actually read through that.
I have some engineers that read through it. So, but most of the time, people just they don't know what it is. Honestly, they don't even know what this book is. They just know they're turning 65. They must do something. We usually have events at our office. It's called ABCs of Medicare. And it's really quite simple because there's only two avenues you can go.
What's that?
Do you remember the old Fram air filters? Pay me now or pay me later?
Fram shipping?
Yeah. There's only two legs. So you either pay me now or you pay me later. And when I talk about the pay me now, we call it supplements, okay, over there on that side. And then the pay me later is what we call our Medicare Advantage plans, your HMOs, your PPOs, and stuff like that.
Okay.
Those are the only two things that separate the difference between those particular programs. But Medicare, they're both original Medicare. One is administered by a private company like some of our local ones, Health First, United Healthcares, and stuff like that. The other one's managed by CMS.
Center for Medicaid Services
Right.
out of Washington.
Right.
Now, you mentioned Health First. Health First is a health maintenance operation.
Correct, sir.
And they have their own network of doctors, care services, and everything else. So if a person signed up for a health maintenance operation, and they traveled a lot, and they had an accident in Rhode Island,
Mm-hmm.
they could be covered under their health maintenance plan with Health First. But if they had a cold or they developed pneumonia or any other reason that wasn't an emergency, I know that
Correct.
if they had pneumonia, that might be one that might be covered.
Yes.
But like what I was getting at was that if you're a veteran or if you you're on Medicare and you have a good payer for your second part of your cover your 20%.
Mm-hmm.
You might want to be very careful before you make a decision to go with any kind of a health maintenance operation that would take you into a specific network of providers.
Right. Right. That's correct. So you have a smaller network to deal with when you're in an HMO.
Okay. Now let's say we've been to see the doctor or we've been in a hospital, we come home and we get this 2 to 10 to 15 pages of all this stuff. It lists all these costs. How important is it that you keep that stuff? Or should you keep it? Do you need to keep it?
I'm going to be careful about how I say this. I say yes, but a lot of that stuff is immaterial because it's taken care of by the, in this case, if you're with Health First, they're going to take care of the costs and everything. So a lot of times what it's called explanation of benefits.
Right.
So I try to tell my folks, you need to probably look at this because sometimes they can double charge you. And a lot of people don't realize that even though you're on Medicare, you think the carrier is going to take care of it or CMS. You have a lot of power yourself to call that particular provider or hospital and say, I don't agree with this particular bill, even though you've, my coverage pay for it. We've seen times where you get double billed for something that wasn't there. And if people would take more attention to that, we could probably drive down some costs to Medicare.
My wife and I have a gentleman we take to and from church on Sunday. And in talking to him, he's had that problem where he has to pay particular attention. By virtue of the fact that we're retired military and on Trying Care for Life, I've never seen a problem as this.
Right.
What I wonder about, Keith, is that I see a charge on the Medicare information card, paperwork that comes back, and it says, we'll pay for this, and this is valued at this, but we'll pay for this. And it never looks like anything is ever covered. It looks like it's always underpaid.
Yes. Yes.
Why is that?
That's
because it is underpaid?
That's the broken system that we currently have in place. So it's always, this is what we're going to charge you. This is what we're eligible to pay under Medicare. So most of the times when you see that thing, it's like, okay, yeah, they're charging 400% over Medicare approved rates, but most of the hospitals and doctors and stuff that just go ahead and take the Medicare approved rate. It's just a matter of negotiating that rate with the carrier.
So I think what may be very important for people, and the vast majority of our population is not military retired. Mm-hmm. It would become extremely important for those people that are completely civilians all the way, mm-hmm. for them to pay attention to them because there could be enormous charges on there.
Right.
Yeah, I never thought about that part.
So one of the things, and that's one of the things that we do when we do reviews with folks, if they keep their either EOBs and they got questions about them, we help them sift through and answer their questions for them, especially people who are on original and Medicare only. So we help them.
What you do is help people understand what Medicare does and doesn't do.
Right.
Do you help bring in skilled nursing services to people that qualify for Medicare that didn't know about that?
Right. So in most cases, it's folks that are eligible for Medicaid services.
Right. Medicaid?
Yeah, Medicaid services. So there's certain programs, and we work. We kind of help them fill out the forms for the DCF under DCF to apply for Medicaid, and then we actually in our building we work with a company that helps do the assisted living. So like a lot of times we'll run into veterans that their spouse passed away and they didn't know they were eligible for aids and attendance through their military spouse. So we help them. We send them over there, and right next door, it's the same building, but right next door, we send them over there to help fill out those forms so that they can get assistance for that.
All right.
And it's amazing how many people don't know about that.
But there's one thing that question number 6 that you put down here, and that's something I want you to talk about. This is called House Bill 21, which talks about opioid abuses.
Yes. Let me take a breath here. Let me start off by saying, if you're taking any controlled substance, it would be a very good idea to talk to your physician on how House Bill 21 affects your relationship and you getting controlled substances from the pharmacy. That's probably the very first thing you need to do is get on the phone and ask them, hey, does this affect you? And here's why. It's actually a good bill because we have an opioid epidemic here in Florida, correct? So, it actually doesn't do any. We already have bills in place for that. This just made some amendments to the current bills that we have, but it's caused some disruption in the industry. For instance, if you're in acute pain management, and we have clients that are in acute pain, and this is one thing I'm worried about. They can only get a refill for the opioid prescriptions on a 3-day period. So they have to go back to a pharmacy, which is called locked-in pharmacy. That's a federal law. They have to pick one pharmacy that'll disperse their opioids every 3 days. Some people can't even get out of bed. I don't know how we're addressing that. It's kind of shocking. So you can get an extension up to 7 days, but still, that's 7 days. That's 4 times a month. You've got to get transportation to the pharmacy for that.
The reason I ask that is because if you will look in this coming issue of Hometown News, you'll see my article in there about opioids. And I'm very frank and talk about my own use of opioids and why I think that this intervention, and I'll call it meddling by legislators into a law which should be more under the scrutiny of doctors, it could be very important to people for the exact same reasons you say. I know if I had I will be beyond the 3 and 7 day because I'm in constant pain and have been for 8 years.
Yes.
Well, I sit here doing this show with you. I'm probably my pain level right now is about a 5.
Right.
And
I don't know how we're going to.
I don't either because sometimes if I go to a certain pharmacy and I have to go to one now to get it,
Yes.
they may be out of it.
That's a good point.
Yeah, they don't think about this. I've gone to Walgreens and actually been out of the drug, and it takes 2 or 3 days to get it in. What the legislators don't understand is if you are on opioids, the denial of that, what was called like the DTs. I mean, you go crazy if you can't get your medication because that's there are addictions for different reasons. And if you need a pain medication, and I have been under so many different pain medication plans, they've obliterated nerves in my legs and everything else. But I can feel for the people that are going to be under this 3 and 7 day plan. And somehow we have got to convince the governor that that was a bad law.
I agree. I have to agree.
It was a bad law for certain reasons, and it was a good law for other reasons. But in this case, I think the bad is going to outweigh the good that can come from it, because if people
I
want to
think-
abuse the drugs, they're going to abuse it no matter what.
Right. They're going to find ways to get around it.
Right. The same as somebody wants a
Right.
gun.
Right. Absolutely.
So,
Another thing that happened, so we're just talking about opioids, right? Well, they threw it all under controlled substance. So this happened to a family member of mine. My doctor, his doctor said, I'm not prescribing any more controlled substances anymore. And this could be Xanax or something, something like that. I'm not going to do that anymore because my fines are so heavy, I could lose my license after the third violation. So he's stopping. He's not going to prescribe them anymore. So now we have people with mental conditions that need some of these controlled substances to maintain their balance. And if doctors start dropping out of doing it, where are we going to go?
that's a good question, because this is not something that can be controlled with natural or organic medicines.
Right.
It cannot be. And you have to be there and to experience it.
Mm-hmm.
I would like to see somebody that has gout in both feet or both their knees walk on gout in your legs. It's not very pleasant.
No, you're not.
It's not pleasant.
No, not at all.
There are so many. We're going to have to do another show on this, because there are some things here that I wanted to talk to you about, because I think our viewers need to know more about what you do. So when we film the next time, when we get you back, we'll talk more about it, because we're out of time today. And
Okay.
but I think what the service you bring to the community is tremendous, Keith. I have to tell you that.
Well, thank you. It's actually a pleasure. I tell you, one of the best things that we do is our seniors, and I buried one of my clients. He was 93 years old. He actually fought in the Battle of the Bulge. I loved talking to him. He'd tell me stories, and it just, as veterans, we enjoy each other.
Okay, we're out of time.
That's right.
Thank you. I'm Joe Steckler. Thank you for joining our program today. I'd like to remind you that our senior information line is available to you at 321-473-7770. There you can get help and direction that could be helpful for your specific situation or circumstances. The work of helping seniors is very important, but we can't do it alone. That is why our sponsors here in Brevard County are so important. I'd like to thank our many area sponsors, businesses, and medical providers who support the mission of helping seniors that help us carry the cost of our media efforts. If you'd like to join us either as a business partner or simply donate as an individual, we would welcome your call at 321-473-7770. You are always welcome to visit our website at www.helpingseniorsofbrevard.org. Thanks so much for your help. It does make a difference.